I want to welcome you all to my first episode of my new podcast. My name is Dr. David Dempsey, better known as Doc Dave, and this podcast is called On Call with Doc Dave. We're going live today, and I'm so excited to bring this podcast to you. The wealth of medical knowledge that I will bring to this medium will be extremely beneficial to you. You may say to yourself, well, I can go on the internet and get information, or I can call my doctor and get information from him or her. Good luck on that. The internet is very valuable and it's effective to a certain degree. It just kind of gives you plain facts. It really doesn't explain things to you in more personal detail like I will be able to do. I can't remember the last time I had a conversation with my computer on the internet and got a response back from it. So this is what I'm going to do. Once these episodes are finished, you just feel free to email me, ask me further questions, or you want to know more about the episode that we just went over, whatever it may be. There's going to be dozens and dozens of episodes in the future. So, you can look at my file on my podcast, and I will have the listings of when the episodes are coming up next. I'm going to try to release one episode a week so that, or you can just say, hey, I want a specific episode that's not listed on this file. Can you please address that? And of course I will. That's what I'm here for. I don't want this so structured that you don't have any input and you're just listening to my episodes that I deem to be of interest and of importance for you. So, with that being said, my first episode I'm going to discuss today is called Gout. And everybody's going to say, well, what's gout? I don't have gout. I don't know anybody in my family that has gout. But, some of you people that are listening are probably and hopefully pretty young. And you may not have it now, but you may have it in 10 years, 12 years, who knows when. And if podcasts are still, available at that point, you can refer back to my podcast and say, oh, here's the one on gout he talked about way back when. So, keep them as a reference for any future needs that you may have, or your family members may have, or friends or coworkers or whatever. You can refer them to this podcast and everything will be listed there. So the reason I chose gout out of the hundreds of episodes that I could choose from, hypertension, diabetes, heart disease, lung disease, neurologic disease, etc., was a personal reason. And that's why I'm doing this podcast, because it's for personal reasons that people that I either know or that are listening to the podcast that request a specific disorder be discussed. This disorder of gout was brought to my attention by one of my best friends 2 days ago. It just happened while I was thumbing through a list of episodes I wanted to do. And he said, you know what, last night I woke up in the middle of the night and I had this severe sharp pain in my big toe. I had no idea what it was. I didn't traumatized the toe. It wasn't infected. I didn't have a fever. There wasn't any insect bites. I didn't get a foreign body in the toe. I had no idea what it was. So I got up and I had actually looked it up on the internet, and the internet gave a number of different, conditions that it could have been. But the thing that struck his attention was gout. He had no idea what gout was, and it was kind of limited on the internet how it was explained to him. So he knew I was putting this podcast together, and he says, hey, gout, can you discuss gout for me? Because, I think it would be a good start, and, people may have it, or people are going to have it in the future, or people may know somebody that has it. So can you kind of bring that up in one of your earlier episodes? So I said, yeah, I'm going to do that as my first one, just for you, because you're my friend. And that really going to give me a good kickstart on this podcast. And that's what I want you people out there listening to feel free to respond to me just like he did. I mean, if you're my listeners, you're my friends. And if you're my friends, I'm going to respond to whatever request that you have. I have a wealth of medical knowledge. I've been practicing for 50 years. There's nothing I haven't seen. There's nothing I haven't experienced. And there's nothing I haven't learned about medicine. So it's not going to be an inconvenience for me to have to look up this stuff and put a podcast together. Most of this stuff is just going to come off the top of my head, because that's the kind of podcast this is. It's a layman's podcast so that you can understand it in layman's terms. I'm not going to write down, a bunch of critical information that you don't really want to hear. It's all going to be very practical information. So let's get started on gout. I mean, what is gout, and how does it work? What causes it? How do you treat it? This, that, and the other. So the way I'm going to structure this is I'm going to break it down into 4 different topics here. I did actually write this down so that I don't miss anything. So the first structure of this topic is going to be the symptoms and the mechanism of the disorder. The second one is going to be the diagnosis. How does your doctor diagnose it? And how do you diagnose it? This is the kind of disorder that you can kind of figure out yourself sometimes. The third one is going to be the mechanism of elimination. How does this gout clear itself from your system? And the fourth one is going to be, how do you actually treat it? How do you treat it by your own personal input, and how does your doctor treat it for you? So the first thing is symptoms. Okay, so usually it's, a male in his 40s to 50s who may be a little obese and, just has a bad diet, drinks a lot of alcohol, this, that, and the other. And then all of a sudden, for the first time, he wakes up in the middle of the night at 3 a.m. and he's got this sharp stabbing pain, usually in his right great toe or his left great toe. It's usually in the great toe. It can also be on the wrist or in the elbow, but that's really rare. 80 to 90% of the onset of symptoms are in the great toe. Why? Nobody knows, but that's the joint that these crystals go to that cause the discomfort and the pain. So that's usually how its mechanism of onset. Now, the mechanism, the disorder itself, which I think is important you kind of understand because it leads into how you treat and how you avoid gout, is usually from ingesting things like in your diet for like meats and alcohol, certain vegetables, believe it or not, and other entities that I will get into later in more detail. But it's usually a dietary assault on your system, and that you have some kind of a defect in the ability to clear this product out of your system through your kidneys into your urine. And again, I'll go in a little bit more detail, but that's the basic function of how gout kind of comes on and, what precipitates the gout itself. So there you go. That's pretty much all you really need to know about the symptoms. Now, the diagnosis is interesting. Diagnosis of gout is usually performed by your physician, obviously. He will draw blood tests, which will look for a certain byproduct in your bloodstream that is called uric acid. And the uric acid is formed from the purines, which are ingested in the foods that precipitate gout. And we'll get into that in another minute as well, but I just want to kind of bring that up so you kind of understand how the uric acid is formed in your system. Now, so that can be determined by a blood test. So that's the first thing he'll do. The other thing he may do, if the blood test is, marginally elevated, maybe not even elevated, sometimes this blood test, this uric acid that they check for in your blood test, if you don't get into the office for like 2 or 3 days, it could be back to normal. And you say, well, wait a minute now, I had this pain. How's the blood test normal? So the blood test isn't always super effective. It's not 100%. So you get a lot of false negatives with the blood test. Now you're not going to generally get a false positive. In other words, if the uric acid is elevated, then you got gout. The second thing they can check for is by doing a joint aspiration. Now, I know that sounds really painful and, very difficult to put through, but, they numb the foot, they block it down like you do when you get a block on your tooth when you go to the dentist. He inserts a needle into the joint and he aspirates out the fluid, puts it under an electron microscope, and he looks for what's called urate spike crystals. And if he sees those, then that's 100% diagnosis of gout. You're not going to lose the crystals like you may miss the blood test being positive. And the last thing he could possibly do, if he needs to, or if the first test is negative and the aspiration is negative, probably get an x-ray of the toe to see if there's some, arthritis, degenerative joint disease, maybe a subtle fracture you didn't know you had. That's kind of rare, but, they'll probably do that just to be complete. So now that we've got the diagnosis out of the way, we're going to look at number 3, things that make gout worse and things that make gout better without formal treatment. So the things that make gout worse is foods and drinks. Now, the foods are generally red meats, and what we call organ meats, which are beef, lamb, pork, bacon, and especially liver, which I don't know the last time anybody's ever eaten liver, but I'm sure some of you probably have. So if that's in your diet and you're coming down with gout, get rid of it. The second one is alcohol, believe it or not, unfortunately. And it's usually red wines, which most people like, and it's also beer. So that's a real downer that, if you got this condition, you got to really start eliminating that input. Now, the third things are beverages made from fructose and sugar. Fruits and sugar, fructose. It's not a good thing in your system if you've got gout because it produces the purines as well. And the fourth thing, maybe some of you will like this, especially kids if you're listening, is certain vegetables. In other words, you don't have to be eating your asparagus, you don't have to be eating your cauliflower, and even your spinach if you don't want. So that's one of the positive byproducts of this disorder. You could say, Mom, I ain't eating my vegetables because I got gout. But you know what? If you're a kid, you ain't going to have gout. You don't get it till you're about 40 or 50. The last other thing is certain medications can precipitate gout. And that would be things like diuretics, because diuretics affect the flow of blood and urine in through your kidneys to eliminate the uric acid, which is the thing that precipitates the gout attack. And the last and most important thing, and the easiest thing to overcome, is dehydration. Because dehydration decreases the urine that you're producing and therefore decreases the blood flow to the kidneys. And the gout isn't getting eliminated out of your system because it's not going through your kidneys. So the simplest way to resolve that is just to drink, glass after glass after glass of water. You don't have to be drinking any special electrolytes. This is not an electrolyte problem. This is a problem with just specific dehydration. And so you just drink Normal, good old-fashioned, healthy water. So now how do you treat gout? Well, there's two ways. There's the conventional way. There's the way that you can treat gout. If you remember earlier, I said gout is treated by you and your doctor. So the best thing for treatment of gout is first, to rest the foot. Do not be ambulating or weight bearing on it any more than you have to. If you got an old pair of crutches or something at home, use those, because every time you put your weight on that toe, it's going to inflame the toe even more. Elevation is always important because you got to get the fluid that's in that joint to drain out of the joint and back into your system so it can be eliminated. The other thing is cool compresses. That'll decrease the blood flow to the area that's affected, usually the great toe again, and that'll cool it down, literally and figuratively. So that's something everybody can do. The other thing that you can do is over-the-counter medications. I don't mean prescriptions from your doctor. I mean over-the-counter medications, mostly non-steroidals, such as ibuprofen, Advil, Aleve. These are all good to reduce the inflammation. The inflammation reduces, the swelling reduces, and the pain reduces. Now, the hard parts. Avoid alcohol, obviously if that's precipitating this. You can't be drinking red wine, you can't be drinking beer, and you got to just, once the condition resolves itself, you're going to have to say, hey, do I want to go through this again, or do I want to take this out of my life? So alcohol, got to start avoiding it. Other thing is avoid the foods that produce the purines. Like I mentioned earlier, the meats, the organ meats, the livers, all those things, certain vegetables, certain fruit drinks, certain, things that we know that produce the purines, which break down to the uric acid, which doesn't get totally eliminated by the kidneys, and then the gout comes. Now, if you want to get your doctor involved, if none of that clears it out, and I think you should get your doctor involved, because gout, can not only is it a symptomatic disorder causing you pain, but it can affect other organs in your system, by the deposits of these crystals into your kidneys, into your joints, everywhere. And you want to try to avoid that. So you go see your doctor, and the doctor will give you a prescription. I'm not going to go over the name of the drugs because this is something you should discuss one-on-one personally with your doctor. But your doctor definitely needs to know of this condition, and he needs to be involved in the treatment of the condition. Now, foods that you can take that will reduce the onset of gout. Now, we went over all the bad stuff. So here's the good stuff. And generally, it's pretty good stuff. It's not like, things that, you don't generally like taking. The first thing is, just take vitamin C. Vitamin C helps to dilute the uric acid and dissolve it and get it out of your system. Cherries, of all things. I didn't even know that. Cherries will help reduce the inflammation of gout. This is a good one. Everybody's going to love this one. Coffee. Everybody says, drink coffee, don't drink coffee. But this is where coffee really helps to get rid of the condition. Skim milk and low-fat dairy products are very effective in reducing the symptoms of gout once it's come on, or for prevention in the future. Whole grain cereals, but not oats. I know some people like their oatmeal, this, that. Anything that has oats in it, but for some reason, nobody explained it to me, oats are not good for trying to reduce gout attacks in the future. Hibiscus tea is good. Now, the main thing, it's in everybody's house, it's in everybody's sink, is water, water, water. Water will flush out the formation of the uric acid, even if you've got some type of kidney disorder that, normally doesn't clear the uric acid. You put enough water in your system, it's going to improve that kidney function, and it's going to help eliminate the uric acid, get it out of your system before it crystallizes and forms this disorder. So that's really pretty straightforward stuff. So there you go. There's Gout. I hope my friend is listening. I'm going to send him this podcast episode personally, so he'll get on board and, subscribe and listen in the future. So this is the conclusion of my episode. I hope this has been really helpful and answers most of your questions. If you would like to have further information on any of this stuff I explained, please contact me. It's very easy. I'm at oncallwithdocdave@gmail.com. That's pretty simple. So you can get in to do that. Now, in parting, I just want to reiterate that, the reason I'm doing this stuff, this podcast, is to really help people, I've been an ER doc for 50 years. I've always had to drive to ERs. I've had to spend 12 to 24 hours there. I've had to see, one patient at a time. Can't remember the last person I treated with gout, to be honest with you, but I have treated it in the past. And, it's a labor of love. It's not the most efficient way to get information to people that have medical conditions. You see one guy, or maybe out of your 30 patients you saw on that shift, 15 of them had the same problem, heart, lung conditions. So you don't really get to explore and explain to people about other conditions, even ones that aren't that common, like gout. But, it's lurking around the corner in some of you, and it might catch up to you eventually. Besides, the reason I like doing this podcast is the best at-home job ever. I mean, I can do this day in and day out and do it for months and still wouldn't be able to explain all the information I know, I have, and that I would love to present to you. So be patient. These will come out. I was originally thinking of doing 2 a week, but since I'm kind of just starting out, I'm probably going to do 1 a week for a couple of weeks, maybe a couple of months. And then as I get more subscribers and more followers, again, please hit the subscribe button. This will keep me motivated to do this, and will let me know that there's people out there that want my help. And, it's just like a pat on the back. So subscribe button, blast that baby. Now, the last thing I probably want to say at this point is that the main thing I'm trying to get out of here is I'm not trying to be a substitute for your doctor. I'm just being an information avenue for you so that when you go to your doctor, it's like buying a used car. You go online, you find things out, you talk to people, you educate yourself. You don't want to go into a car dealership and not have any idea what the cost of a car is or what the upkeep's going to be or, any of those kinds of things. You don't want to be a victim of being uneducated in the process that you're going through. And so you educate yourself before you go see your doctor. That way you're not just listening to what he has to say, which, like I mentioned in my description, doctor speak is very difficult to interpret, and it could be very frustrating to you. So you don't want to just listen to what he has to say. You want to have questions for him. You want to have, you can't go in there with 10 questions because, you got 15 minutes in the doctor's office and that's it. You're out. The door's closed. But you want to have 2 or 3 really pertinent questions. And the only way you're going to get those questions to the doctor is to educate yourself. Because a lot of doctors, not all, will say as they're leaving, do you have any further questions? If you got that kind of a doctor, stick with him. Because a lot of them will just say, okay, gotta go. I got other patients, the nurse will sign you out. So if you're organized enough and have those questions for your doctor, and the only way you're going to have those questions is to either investigate it in yourself in the internet or to listen to somebody like me, which is much more fun because the internet ain't talking back to you. And I am. I'm not necessarily talking back to you. I'm talking with you. So stay on board, pass this thing around. I want this to be the best, hands down, medical podcast out there. And if you enjoyed today's podcast, and I won't be going over this diatribe every time I do a podcast, but since it's my first one, I just want to talk with you a little bit. If you enjoyed today's podcast, you're going to enjoy the next one and the one after that and the one after that. They're only going to get better because this is my first time I'm doing this. So, it takes a little time to figure it out. But as you can probably tell, I'm pretty honest about this stuff. I'm just going from my gut and explaining this. I have a few notes written down, because I don't want to, close the podcast and say, oh, God, I forgot to talk about this. So I have to be organized on this, but I'm just talking from my heart, from my brain, from my knowledge, from my experience, and that's where I want this podcast to go. So, I've watched many podcasts. They always say, okay, make sure you subscribe, hit the like button, tell your family and friends, but I mean that, tell your family and friends. This is really important. There's nothing more important in your life than your health. And, a lot of this stuff's going to be retrospect. Okay, doc, I got this problem. What do I do about it? But some of it is going to be proactive, where I tell you to do things or to prevent things so that you don't get into a case like this gout, Okay, people hopefully are thinking, okay, wow, maybe I should watch my red meats. Maybe I shouldn't drink as much red wine. Maybe, cut out fructose in my sugar drinks, avoid a couple of vegetables that might precipitate things. Because these ailments, they lurk in your body and they're just waiting for the stimulus to bring them out and cause the problems. So, just because you don't have it now doesn't mean you're not going to get it later. And if you want to avoid that or put it off or to minimize the discomfort once you do get it, listen to what I had to say today. So I want to thank everybody for your time, for listening. I'm not quite sure how long this podcast went. I have a way of kind of rambling sometimes, but I think it personalizes the podcast a little bit. And, tune in. They're only going to get better than this. And I'm really looking forward to hearing some feedback. If you got questions, you got my email. If you like it, tell me. If you didn't like it, let me know how I can improve it. I'm all ears. And the last thing I want to say, and I'm going to say this every time when I sign off, is remember, I'm your friend, not your doctor. Don't substitute this podcast for any potential medical conditions you may have or need to have looked at by your actual own physician in the future. So, with that being said, good day, good night, and we'll talk again soon. I enjoyed this very much.